Good afternoon, everyone, and thank you for joining the Maine Health Management Coalition today. My name is Marie Stuckey. I am the Member Relations Manager here, and am pleased to have Chris Boynton from the American Diabetes Association talk with us today about Diabetes Mythbusters, Understanding Diabetes Costs and Solutions. A little business up front, just to let you know, if you have a question anytime, you can put it in our chat box, and we will collect those, and I will relay those to Chris at the end of the presentation. Also, the slides and recording of today's event will be available on our Maine Health Management Coalition website shortly after the event. So I'm just going to go through a little bit of an overview about the coalition for people who are listening that are not familiar with us, and tell you about some upcoming events. The Maine Health Management Coalition is made up of over 80 members, including consumer organizations such as the American Diabetes Association, purchasers or employers who pay for care. Then we have a grouping of health plans, brokers, and benefit consultants, the providers who give care, and affiliate organizations who support our mission as well. So the Maine Health Management Coalition is purchaser-led, and we have multiple stakeholders that work collaboratively. We convene them to improve health and maximize the value of healthcare services for employees and dependents of coalition members and all residents of Maine. We accomplish this through 5 key initiatives, the foundation of which is our data department, where we have all the health benefit claims for the state of Maine. And then we have other departments here that work on transparency and public reporting on quality and cost. We engage our members and consumers and employees in the state through several different initiatives. We work on value-based insurance design to reward the use of high-quality patient-centered care. And we also have a department that focuses on payment reform, exploring different payment arrangements to, again, ensure we have high-quality patient-centered care at a reasonable cost. Some of the benefits of membership in the Maine Health Management Coalition include opportunities to network, learn, and influence. By bringing all these different stakeholders together, it lends itself to fostering valuable connections. We identify best practices in health plan design. Our members have access to our outstanding data analytics team. We can help train leadership and staff through educational events such as this today and other resources, and guide staff to high-quality, reasonably priced healthcare services. It also is nice to be branded as a pioneer in supporting Maine's economy and health by being a member of our organization. We have several work groups that work very hard on moving the needle to increase the value of healthcare in the state, and that's another way to get involved. Some of our webinars include credits, which is a nice benefit, and our members have voting rights for key elections, and we also offer discounts on certain services and conferences. So this slide, all these slides, again, will be available on our website. You may want to circle back to this one if you're interested in any of our upcoming work group meetings. You can see we have from March 15th through April 20th showing on the screen there. So we have our ACI steering committee that pursues payment reform, delivery system transformation, health plan benefit strategies. Our healthcare cost work group identifying healthcare cost drivers and actionable strategies to reduce costs and preserve quality. The value-based insurance design recommends benefit design for high-value services and shared decision-making. The Pathways to Excellence groups identify quality ratings and criteria for publicly reporting those measures. And finally, same thing with the behavioral health group, but they just do it with that specialty of behavioral health. Registration is already open for Tuesday's webinar, also presented by the American Diabetes Association, on improving patient outcomes in diabetes. Providers may be particularly interested in that webcast. And I expect that the next one on telemedicine will be opening, registration for that should be opening in the next few days. And then at the end of April, we have recruiting, retaining, and supporting Maine's aging workforce, which should be particularly of interest to employers. This is just a slide showing you some of our great supportive members that we appreciate so much. And with that, I am pleased to introduce Chris Boynton, the Regional Director of the American Diabetes Association New England. The mission of the American Diabetes Association is to prevent and cure diabetes and to improve the lives of all people affected by diabetes. As Regional Director for the past 10 years, Chris and his team of 20 dedicated individuals have grown and developed special events, Type 1 and Type 2 programming, and community involvement across the New England area in support of the association's vision of a life free of diabetes and all its burdens. Previous to the American Diabetes Association, Chris served as the Vice President of Development at the American Cancer Society for 11 years and is a proud University of Connecticut alumni. And with that, we will turn it over to Chris. And again, thank you so much, Chris, for presenting today.
Thank you, Marie. It's great to be here.
And Chris's slides will be coming up on the screen momentarily.
Great. So thanks all for joining us today. I'm going to give you a little background on diabetes and what it is and what it isn't, and hopefully give you an idea of some of the general perceptions out there and how we can turn those around. So just to give you a little primer on diabetes and what it is, there are several types of diabetes. Type 1, Type 2, gestational, and pre-diabetes. Type 1 diabetes is an autoimmune disease, and that's the one that was previously called juvenile diabetes because in past years, people primarily got diagnosed when they were in their youth. And that is as an autoimmune disease is when your body's autoimmune system starts killing off the important beta cells in your pancreas, which make insulin. So you have no insulin in your body. Insulin, I should tell you, is a hormone that helps your body process the sugars in the food that you eat and turn that food into energy. So in a type 1 person, they don't have that insulin. It's very hard for them to convert that food into energy. Type 2 diabetes, previously called adult onset diabetes, occurs as you age, and your pancreas, the insulin in your pancreas creates either becomes less abundant or less effective. So you need to sort of supplement that. Now we call them type 1 and type 2 now because those age differentiations have started to blur. There are more adults being diagnosed with type 1 diabetes, and there are more youth being diagnosed with type 2 diabetes. And type 2 diabetes is not an autoimmune. That's more of a lifestyle disease. There are several risk factors we'll talk about a little later that they can affect your likelihood of being diagnosed with type 2 diabetes. Gestational diabetes is when a woman who did not previously have type 1 or type 2 diabetes develops high blood glucose levels, usually around 24 months of her pregnancy. What needs to be paid particular attention to that is that the child and the mother are at increased risk for type 2 diabetes later on in life. Prediabetes is another topic that's becoming more prevalent. Prediabetes means that those are people who have elevated blood glucose levels, but not quite at the level that you'd be diagnosed with diabetes. Besides the disease itself, the tricky part is really the complications that come along with diabetes. And those complications are around heart disease and stroke, kidney problems, foot ulcers and amputations, nerve damage, and eye problems. Really any part of your body that's dealing with, that has very small blood vessels, that glucose that's circulating through your body and not able to get to the cells to be used as energy, that sort of circulates around your body and sort of clogs things up is sort of a simple way to think about it. Just to give you some idea of some of the statistics around diabetes now, there are about 30 million children and adults living with diabetes, both type 1 and type 2 in the U.S. About 1.7 million are diagnosed every day, or every year, I'm sorry, and 18,000 youth are newly diagnosed with type 1 diabetes. The breakdown between type 1 and type 2, there are about 95% of all people living with diabetes have type 2 diabetes, and about 5% have the type 1 diabetes, the autoimmune type of diabetes. One of the startling statistics around diabetes that we talk about often to try and create this sense of urgency around the issue is that if present trends continue, about 1 in 3 American adults will have diabetes by the year 2050. And diabetes is the primary cause for death for 69,000 Americans each year, but it's those complications, the heart disease, the stroke, the kidney issues that really account for many more deaths annually. And those are not often, diabetes is not the primary cause of death as stated on a death certificate, but really was the primary cause of their death, or a major contributor to their death. And the issue of prediabetes, the people walking around every day with elevated blood glucose levels, we have about 86 million Americans, so quite a percentage of our population is walking around with those elevated blood glucose levels. This is one of our neat infographics, sort of, like I said, trying to create a sense of urgency around the issue of diabetes. Our first myth of the presentation is that if you're overweight or obese, you will eventually develop type 2 diabetes. And that is incorrect. There are a significant percentage of the population that is overweight that does not have diabetes. However, being overweight or obese is a significant risk factor. But also family history, ethnicity, and your age also play a role in your risk factors. On the other flip side, 90% of the people living with type 2 diabetes are overweight or have obesity. And that's putting added pressure on their body's ability to use their insulin or to properly control their blood sugars. But like I said earlier, diabetes is a disease of the aging. As we get older, just like your car, things start to wear out. And one of the things that sort of starts to wear out is your pancreas, its ability to create insulin or create insulin that can be used effectively by our body. So we all sort of are at risk for diabetes as we get older. Our next myth is that people with diabetes cannot perform certain jobs. This is an area the American Diabetes Association is taking a particular interest in educating employers and educating people about diabetes and people at work. The fact is that people with diabetes have rights, and federal laws prohibit discrimination. Several laws do. One of the ones that you're probably most familiar with is the Americans with Disabilities Act. It says, several laws say that people with diabetes cannot be discriminated on the job. Employers cannot fail to hire or promote because of diabetes. They cannot terminate you because of your diabetes unless it poses a direct threat. Employers must provide people with diabetes reasonable accommodations to help perform essential functions, and they must not discriminate with regard to employee-provided health insurance because of their diabetes. Another myth that we hear often in our office and with our volunteers here often is that eating too much sugar is what causes diabetes. Really, the fact is that type 1 diabetes, like I said, is an autoimmune disease caused by genetics and sometimes some other unknown factors. Oftentimes we hear that people were diagnosed with type 1 diabetes after a bout with a virus, the flu, something like that. The number one time of the year when people are diagnosed with type 1 diabetes generally is the January, February, March time period when you're most likely to have the flu. Type 2 diabetes develops when the body becomes resistant to insulin or when the pancreas stops producing enough insulin. And so exactly when that happens is unknown at this time as well, but a lot of our research is focused on what it is that triggers that conversion. Another myth is that people with diabetes need to follow a very special diet, and that is untrue. We find, just like with other major health diseases and risk factors like heart disease or cancer, that simply eating a healthy diet that includes lots of fruits and vegetables, high fiber, foods of different colors, those things that you hear regularly, those are the same things that people with diabetes need to do. This is just another infographic about some of those myths and the facts around them. People with type 2, one we didn't really touch on, is people with type 2 diabetes who need to use insulin are in serious trouble. Type 2 diabetes is a progressive disease and gets sort of gradually worse, and we can sort of prevent or prolong the amount of time that someone moves along through that course to needing insulin, but it can be controlled with other oral medications, good diet, exercise, that kind of thing, but a lot of times people do need to eventually go on insulin to control their blood sugar levels. Like we said, it's not just about being overweight. A lot of different factors play into being diagnosed with diabetes: ethnicity, age, lifestyle, and genetics. Ethnicity is important because 1 out of 11 Asian Americans, Native Hawaiians, Pacific Islanders have diabetes, so that their risk factor is much higher than Caucasians. Now, you were also sent a link, I believe, to our risk tests, and this risk test can be taken online. We have paper versions of them that be passed out as brochures, but it really is a great tool to use in places of work, community centers, that sort of thing, to let people sort of have an idea about their risk for type 2 diabetes, this is. And there are just some simple questions, and you can sort of take this along as we go through the slides if you'd like. Just keep track of your points on a piece of paper, and we'll let you know what your risk is as you go along. So the first question is, are you a man or a woman? If you are a woman, have you been diagnosed with gestational diabetes? As I said earlier, that does put you at increased risk later on in life. Do you have a mother, father, brother, or sister with diabetes? Have you ever been diagnosed with high blood pressure? And then how old are you? Different points, as I said, as you get older, you are at increased risk. And then are you physically active? And then what's your weight? And you can look on the scale here to figure out the total points. If you look at where your height is on the left side and then your weight on the right side. And the point scale is on the bottom. If you scored 5 or higher, you're at increased risk for having type 2 diabetes. However, we say only your doctor can really tell for sure. You need to have a simple blood test that will really confirm that. But it's important for people to know. We talked about the number of people who have diabetes. So unfortunately, about 25% of the people who have diabetes right now don't know they have it. So that's an area that the American Diabetes Association is constantly trying to lower. If you know you have diabetes, you can start doing things about it to manage it better. So the 25% of the American population who has diabetes is not doing anything about it. That's when those complications can start accumulating: the heart disease, the kidney problems, the eye issues. Diabetes is a very expensive disease to manage and to deal with for the American economy, essentially. About $245 billion is attributed to diagnosed diabetes in direct and indirect, and you can see the breakdown there for the direct and indirect costs. One of the things that's very startling is that 1 out of 10 healthcare dollars is spent treating diabetes. So diabetes is really important for people who are managing employees, managing employer health care programs, that kind of thing. It's a big drain on healthcare dollars. So 1 out of 10 is spent directly on treating diabetes itself, but 1 out of 5 healthcare dollars is spent caring for people with diabetes. So that really speaks to some of the complications, some of the productivity issues that come along with someone who's living with diabetes. And the one that's really startling to me is that last year, about 88 million sick days were taken by people who have diabetes. That also speaks to just the general how diabetes can affect you. Going back to the direct and indirect costs, I can break those down for you a little bit. Some of the direct costs, hospital inpatient care is about 43%. Diabetes medication supplies is about 12%. Retail prescriptions to treat complications is about 18% of those costs. Physician visits about 9%, and nursing residential facility stays are about 8%. And the indirect costs really are going back to some of those work days, that absenteeism and even the presenteeism that really is very, very expensive. The good news is that type 2 diabetes can be prevented, and it can be, if it can't be completely prevented, it can be prolonged. You know, you want to push off to as late in life at the time you're dealing with some of these issues. And that's kind of the startling part about type 2 diabetes, and we started talking about how those age lines have been blurred. So in the past, 30 years ago, 30 or 40 years ago, when someone was diagnosed with type 2 diabetes, they probably were in their 60s or 70s. And then the amount of time that they were living with diabetes and managing it and sort of having the opportunity for some of those complications to catch up with them, by the time the complications caught up with them, they would be 75 or 80 years old, or they might have died from something else before those happened. But when you talk about a 28-year-old who's been diagnosed with type 2 diabetes and is starting to accumulate some of those damaging factors that come along with type 2 diabetes, like the eyesight, the kidney issues, heart and stroke, you add 15 years onto 28, you're going to be, you're 43 years old and still entering the most productive time of your life. So that's what's so startling about some of these type 2 statistics, and people, and the average age of diagnosis is decreasing, becoming younger and younger. Also, the good news about type 2 diabetes is you can really reduce some of your risk factors very, very easily. Well, maybe you don't think they're that easy. When you say you have to lose certain, 10 to 15 pounds, that might not be so easy, but at least it's a target for some people to strive for, and really can help fall back out of that category. People who have type 2 diabetes can lose just a few pounds actually, and sometimes fall back out of that category, meaning their blood glucose levels fall back down below into normal areas. We have a worksheet we use that you have also been sent ahead of time with our cost calculator, that we get some of the statistics from the Kaiser Family Foundation. And we put together a sample here that just gives you an idea of workplace costs for a company that has a size of about 1,000 employees. And putting together those, plugging in your company's employee number into that worksheet we sent, you can figure out what some of the numbers of people who have diabetes, pre-diabetes, some of the insurance costs are for your company. But this sample we have here of 1,000 employees, if you have 1,000 employees, and depending on sort of how your age demographic skew for your company, if you have an older demographic in your company, the number will go up. If it's younger, the number will probably go down. But on average, about 120 employees will have diabetes. Like I said before, some of them will be undiagnosed. That's about 34. 370 of them will have pre-diabetes, so they're at risk for being diagnosed a couple years down the road. We know that people who have pre-diabetes that don't do anything about it, about 50% of them will be diagnosed with diabetes within the next 5 years. So pre-diabetes is really one of our areas of focus, because it's when you have time to still do something about it. And I always compare this to, imagine if you had a pre-cancer kind of opportunity where someone told you that if you can change your lifestyle, change your behaviors a little bit, and then you will not be diagnosed with breast cancer, you won't be diagnosed with pancreatic cancer, that sort of thing. Wouldn't you seize on that opportunity? I think most people would. Unfortunately, in the area of diabetes, when physicians are talking to their patients about you have elevated blood glucose levels, sometimes they don't make it sound as serious as it could be, and other times the patients themselves don't take it as seriously. It really is an opportunity. It's a little bit of a wake-up call for you to change some things in your life. You don't have to change everything wholesale. We say just change a couple things, and you can really make a big difference. And you can see at the bottom here how much the diabetes is costing because of the high costs that we talked about before of the treatments, the physician visits, the supplies, and some of the productivity issues. Here's what that cost calculator looks like. It's very simple, sort of almost back of the napkin kind of thing. But you just plug in the number on the top there where it says number of people in company, and it'll sort of automatically calculate it for you. Particularly to Maine, we can take some of our statistics, and I think Matt Peterson, who is the American Diabetes Association statistics king, next week I'm sure he'll give you some of these statistics as well. But diabetes costs in Maine are about $1.7 billion each year. That's between the direct and the indirect costs. And people with diabetes have medical expenses about 2.3 times higher than those who do not have diabetes. There are about 138,000 people in Maine who have diabetes, and 386,000 have prediabetes. The good news is there's a lot of research going on now in diabetes, and for a while there we felt, for the people who are advocates for people living with diabetes, felt that we were sort of getting the short end of the stick as far as the federal research dollars, and relative to other diseases we probably still are, but there's been some good news in recent years where the amount of funding for diabetes research has been increasing. One of the areas of the government that does some research is called the National Institute of Diabetes and Digestive and Kidney Disease, and they're part of NIH. And they've invested about $3 million, a little over $3 million in diabetes-related research projects recently. And in 2014, another part of the federal government, the Division of Diabetes Translation, spent about $531,000 on diabetes prevention and education programs right in Maine. And since 2005, the ADA has provided about $345,000 in our targeted research projects in Maine as well. One of the programs that we are trying to promote for employers to encourage more wellness, to encourage diabetes awareness, is a program that we designed called Wellness Lives Here. And it really is sort of a grouping of a lot of different things that we do already. And we encourage you to go on our website, which you'll see at the end, diabetes.org, and you'll be pointed to lots of resources we have for our employers in trying to manage their employees who have prediabetes or diabetes, and some of the prevention things that we can promote as well. So Wellness Lives Here is an initiative designed to promote health and wellness and encourage healthy living. We have centered some of our activities around 3 what we call mission activation days. So days where we really want to elevate the level of awareness and bring attention to diabetes and do it in the workplace. The first one that's coming up just in a couple of weeks is our Diabetes Alert Day. And the purpose of that day is to bring attention to those people who are walking around, as I say, with diabetes but don't know it. So we're encouraging people to take the diabetes risk test. And you can get that on our website as well, diabetes.org, or you can call me at the end and we'll provide you with some of those written, those brochures, and just to encourage people to take the test. And then hopefully, if they are at risk, visit their physician and start doing something about it, because that really is the key. Diabetes is something, a disease sort of different than other diseases in that the person living with it has to take such responsibility for their own care. The next mission activation day is National Get Fit, Don't Sit Day. You've heard, I'm sure, more and more about how we think that sitting is the new smoking. It really is very important for people to be up and be active, not just to go running, to be physically fit. We say 30 minutes a day, most days of the week, but also during the course of the workday, just to get up and walk around, take a walk around the building, park your car in the back of the parking lot. So you have to walk farther to get to the door. Just get up and get moving more times throughout the day, and encouraging people to set reminders. So every hour, if something goes off, and they get up and walk around, go get a drink of water, go get a cup of coffee, go say hello to someone. But we need to get more active. And then November, during Diabetes Awareness Month, is our National Healthy Lunch Day. And that is an opportunity for people to either bring in a healthy lunch that they pack themselves, or in company cafeterias and that sort of thing, really encourage to demonstrate what a healthy lunch would look like. Another part of the Wellness Lives Here is recognizing companies that are already doing great things for their employees to encourage health and wellness by providing smoking cessation, by providing gym reimbursement for gym memberships, by encouraging walking clubs, by the food they provide in vending machines. They're providing healthy options in their vending machines or in the cafeteria, that kind of thing. We want to recognize companies that are doing things like that so they can apply for our health champion designation. You can go on to diabetes.org to find out more about that, or give me a call or an email. Another program that's sort of wrapped into this umbrella is our Stop Diabetes at Work, which incorporates some of the things that I've already mentioned. You know, how to set up a walking club, how to provide healthy meetings. We know that, you know, in our places of work, we often have meetings where we get together, you know, in task forces and that sort of thing. And often you go into the room in the morning and there's a plate of bagels or a plate of Danishes or donuts if someone ran into Dunkin' Donuts on the way in and grabbed. We have other options and other ways that we can do that. We provide suggestions for that. Also, we provide nutrition guidance for people at home. We have a tool on our website called My Food Advisor, which can suggest healthy substitutions for ingredients or entire side dishes and that kind of thing. What your plate should look like when you're eating at home or at work. The composition of what a healthy meal looks like. And then also in the workplace, you know, how to organize a healthy work environment, both in your own workspace, but also, you know, encouraging people to take the stairs, encouraging people to, you know, get up and walk around a little bit more. We also have tools to educate employees through your own intranet. What are some of the messages you can provide to provide a little bit of education about type 2 diabetes and cardiovascular disease and diabetes complications. There are other ways. We also encourage people to get involved in some of our activities. We have ways for people to get more active. Sometimes people will participate in a walking club, or they have a biking club, and they do that during lunchtime. And we would encourage them to celebrate some of those activities at one of our own events. We have our own events and have our Tour de Cure right in Maine, the Kennebunk's Tour de Cure. That's a way for people to celebrate their being active, celebrate their physical fitness, and to take place. And that event takes place in June and starts and finishes at the Wells Reserve. You can find out more information from that on our website as well, diabetes.org. So here's my contact information. If you want to find out more about some of the things we talked about today, you can reach me at my email address, and our 800 number is at the top as well. I hope this was helpful in giving you a little outline about what's going on in the world of diabetes, how employers can help prevent and manage diabetes, some of the statistics about how diabetes is impacting your workforces and your workplaces, and it is something that, you know, we need to elevate the discussion. We need to elevate the sense of urgency around diabetes. It really is affecting so many of our families. About 1 in 3 of families are touched by diabetes, type 1 or type 2, and really is affecting our communities. So thanks for the time today, and I'd be happy to take any questions.
Thank you so much, Chris. Very much appreciated. I wanted to point out, you mentioned it, but the handout for the cost calculator, it is attached right here on the screen for those that are tuned in. We had somebody point out that they had a little trouble downloading it that was using Internet Explorer 11, but no worries there, because when we post the recording of this event, we will include the slides and the handout. That'll be on our website, and if you have any interest in that or difficulty locating it on our website, you can contact me. My email is and phone is right there on your screen. Also, at the end of this event, you will receive a survey, and we really would appreciate your feedback on how this has been for you. And I do encourage you to take that risk test. I actually took it myself, and it's so quick to take, and it's helpful, I think. And we are also working to promote for our members to think about that health champion designation that you talked about, Chris. So I think that's a great way to kind of benchmark yourself as an employer and see where you stand in terms of improving the healthy culture of your organization. So for a few questions here, I did notice actually, Chris, that on the slide for the risk test scale, it didn't seem to, unless I missed it, I don't think it really identified gender. It just had the weight and height. Is that something that is not necessary to apply on that slide?
Gender was the first question on the scale, actually.
Well,
but
I'm talking about
not on the weight. Yeah, but the weight it doesn't matter sex-wise on the weight and height scale. Is that what you're talking about? Yeah, that does not,
exactly.
not a factor in that. Yeah, that's not a factor on that.
Okay, just wanted some clarification on that. Are you able to share any information on the diabetes prevention program?
The Diabetes Prevention Program is a national program that is rolled out by the government, and it's great statistics on people who go through this program, and it's being implemented locally throughout the country, generally in the local YMCAs. So they sign up and participate in those programs through your local Y, and that's about nutrition, losing some weight, and then becoming more physically active. And we have great statistics that show that people who go through that program have great outcomes as far as lowering their A1Cs, their blood sugar levels, and becoming healthier.
Okay. Let's see here. There was also a point in the presentation when you talked about this moderate exercise and how some simple moderate exercise could potentially really move the bar in terms of making you safer to not become a candidate for diabetes, type 2 diabetes. Can you give an example of what you would describe as moderate exercise that maybe an employer could implement as a program to meet that kind of need?
Yeah, I think people think that if they're going to become more physically active, it means they have to start running marathons or 5K races, and that is not the case. We encourage employers just to have walking groups where even if you don't have a great place around, walk around the parking lot for 15 minutes during lunchtime. Some employers are getting a little more into it, and they might have Zumba classes in their in the afternoons in their conference rooms, that kind of thing. But getting back to really, when I say moderate activity, really gardening, cutting your lawn, raking leaves, all those kinds of things count as moderate activity. It doesn't have to be, running races or, canoeing 5 miles on the river, that kind of thing. It really is moderate activity is getting up and moving. These, in 2016, anything more than sitting on your chair watching TV is considered moderate activity, and that's what we need to try and get to.
Okay. What is the American Diabetes Association doing locally here in the Maine area, and how can people get involved?
Yeah, we have a couple programs. We have a couple of companies in the area that are getting involved in this sort of way with some of our employee engagement days and through some of our workplace wellness activities. Anthem Blue Cross Blue Shield has adopted our National Healthy Lunch Day, and they're conducting the Get Fit Don't Sit Day. In Scarborough, Sun Life is getting involved with some of the mission engagement days as well. So those, you can reach out to those names in the back of the presentation, myself or Emily Silvanac, who's right there in Maine, to get involved. We have LL Bean is also involved in some of the things we're doing. So we encourage you all to get involved in some varying extent, whether using the materials we can provide or adopting some of these mission engagement days, just to bring awareness to diabetes. I think the more it's out there, the more we're talking about it, the more people are aware, and the more higher the opportunity people start doing something about it.
Okay. And I'll just remind people that if they have any additional questions at any time, just type them right in the chat box. But I also have this question. Have any local companies started to get involved with Wellness Lives Here mission engagement days?
Sure, Anthem has got involved. The Sun Life and LL Bean are all involved locally, and this is something that just kicked off in the last couple of months. So we are anxious to have more companies participate in these activities.
Great. Okay. Well, do you have anything else to add, Chris? Because I think that we're set with the questions, unless anybody still, wants to type one in the chat box.
No, I just want to put in a plug again. If you do want to get more involved with the American Diabetes Association, please let us know. If you'd like to get more involved and have an opportunity to get more physically fit yourself, look into the Kennebunk's Tour to Cure. It is an event that is a great, very scenic bike ride, helps raise some money for diabetes to pay for all these programs we're providing, and there are rides and lengths, distances for everyone, from kids rides that are 7 miles all the way up to those hardcore people who want to ride 100 miles. And it's really, really a great ride, really well executed, safe, and a lot of fun.
Okay, great. I do have another question here. What are some innovative activities that employers are doing to look upstream to identify people with prediabetes? That's a great question, because it's kind of difficult to make those identifications. Do you have recommendations for that?
Some companies are really sort of getting into big data and analyzing, analyzing utilization of their healthcare benefits and identifying people that are in that category of prediabetes or type 1 or type 2 diabetes, and really aggressively managing those people with, calling them outreach on a fairly regular basis to help them manage their diabetes, keep up with their visits, their physician visits. And there are some things that we all encourage for people living with diabetes, and that's to get their feet checked once a year, their eyes checked once a year, to have their lipids checked, and cholesterol. Lipids is cholesterol, and so those programs are trying to more aggressively manage those employees to make sure they're taking care of those things, and then therefore preventing some of those complications later on. So the more progressive companies are really being more aggressive, I would say, about how they manage that population.
Well, that's very helpful for the management, but I think what we're looking for here is maybe some more recommendations for how employers have successfully identified somebody who's pre-diabetic. You mentioned in your presentation that some employees and people in general may not even know they have diabetes. So for an employer to identify an employee without getting too personal, what are some good tactics that have worked successfully for early identification?
I think we have companies that have adopted use of the risk tests, and around some of those days, the mission engagement days had encouraged people to take those risk tests. And that really is sort of your entry into the system. You take that and then to go visit your physician. And it's pretty simple. Once people take that risk test and find out they're at elevated risk for being diagnosed, I think that's sort of their opportunity to spring into action. So the employers are really, it's all about trying to get people to take that risk test.
Okay. Yes, and again,
they can offer incentives. We have companies. In my experience, incentives work great. So anytime you can offer, a preferred parking spot, or sometimes it gets, days off or gift cards, that kind of thing. Incentives are the way that we can get people to fill out those risk tests.
Right. Now that makes sense. That's good. That's good advice. Okay. Well, wonderful. So again, please ask people to take the survey at the end here, and we will have the recording and the handouts on the website. I can also email them to you. So there's all sorts of ways to get access to the risk test, or if you're having trouble downloading the cost calculator that's attached here, no worries, we can still get that to you. So Chris, thank you so much. I really appreciate all the great information, and yeah, have a wonderful
Thank
day,
you.
everybody.
Thank you.
Thanks so much. Bye-bye.